of medical colleges, increased push to health insurance from the government sector, telemedicine are some of the major initiatives that are tremendously transforming the healthcare sector in the country. This is a good increase over the previous year's budget. The prestigious National Health Mission was allocated rupees 29,085 crore rupees. The Pradhan Mantri Swasthya Suraksha Yojana has been allocated rupees 3,365 crore this year. The massive amount of rupees 6,835 crore has been reallocated for the establishment expenditure of 22 new aims under autonomous bodies as a part of the central sector expenditure. The Ayushman Bharat, because I always laud the Ayushman Bharat scheme, because as a doctor practicing, we have seen patients dying for want of money, for want of medicines, for want of acute care, for want of tertiary care. So in fact, I celebrated the day when the Ayushman Bharat was introduced, because as a doctor who got my training in a peripheral medical college, the Tanjore Medical College, where we treat more number of farmers, marginalized people, and downtrodden people, economically compromised people, I have always felt that we have to help the people, and the government hospitals are the last hope of the downtrodden people, and we have to help them. And when our Honorable Prime Minister introduced Ayushman Bharat, I was celebrating it because we were the students and doctors who personally saw the sufferings of the people who were losing their life for want of assistance and resources. And that Ayushman Bharat Pradhan Mantri Jan Arogya Yojana has received the budgetary allocation of rupees 7,200 crores this year. This is 12% increase from the previous year's budgetary allocation for the same. This aptly reflects the Union government's focus on bringing 40 crore more people under the Ayushman Bharat health coverage. The allocation will help extend the vital health insurance coverage to the people who are till now not covered under the private or public sector health coverage. The increased allocation to Ayushman Bharat is expected to give a big boost to the investments in the healthcare sector in the country. With an objective to give a big push to the human resources for health and medical education, the union budget has allocated rupees 6,500 crore. The objective in allocating this amount is to help the states and union territories for establishing new medical colleges, upgrading district hospitals, upgrading and strengthening of nursing services, establishing pharmacy schools or paramedical institutions, increasing undergraduate and postgraduate seats in existing medical colleges, etc. I am confident that this will contribute for strengthening of the medical education and services. A major boost is also being given to the nursing sector in the country, and this is in tune with the establishment of 157 new nursing colleges. Really, one point which I highly appreciate in this budget is introduction of the nursing colleges, because we always, doctors, always we have felt. In a lighter sense, I used to say, even an emergency can be attended without a doctor, but an emergency cannot be attended without a nurse. So the amount of support we get, and as medical students, we all know, we learned our injection, and we learned our dressing, and we learned our incision, and we learned our sutures, everything from the nurses. The dedicated nursing staff and nursing fraternity really helped the medical field and introduction of and need of the Indian nurses are appreciated. Not only doctors, Indian nurses and Indian paramedics are appreciated all over the world. They need the nursing staff, and there is a high demand for the nursing staff not only in the country, in the international level also. I am hopeful that the initiative of making some select ICMR labs to be made available for research will open the avenues for encouraging the collaborative research and innovation. The launch of Unified Skill India digital platform will surely expedite the aggregate public and private sector and academic institutes to provide healthcare skilling courses, which is in need of the hour. This will promote multidisciplinary approach. And lot more I have prepared, but I don't want to take the time of the starvers who are come here, and they are great medical academicians who have come here to share their views, and I value their views. So I complete my speech by telling I would like to remind you all of the 7 core priorities that are known as Saptarishi, or inclusive development, reaching the last mile, infrastructure and investment, unleashing the potential, green growth, youth power and financial sector. I am sure the country is firmly on its path in making some giant strides in healthcare sector and ensuring the massive infrastructural and qualitative boost to the medical and healthcare sector. I really thank our Honorable Prime Minister and our Health Minister and our Finance Minister for a good budget, and this budget definitely will improve the health sector in our country. And I want to hear and I want to share all the views from the great personalities who have occupied the dais. And if at all any, not only assessing the and analyzing the budget, if at all you find anything to be done, we can always write to the government so that these all needed more for the healthcare sector. So that is also you can project. It's not only, and if at all you need more to be told, not only appreciating, if you want to highlight some points which should be focused more than which was focused now, that also you can freely tell, because our aim is to reach out the public with a good medical infrastructure. Thank you so much.
Thank you, ma'am, for your remarks and paving the way for the discussion today. I now request Executive Director, AIIMS Bibinagar, and Founder Dean of AIIMS Bhubaneswar, my mentor, Dr. Vikas Bhatia, to come and present his views.
Namaskar. Good morning, Honorable Governor, Madam Dr. Tamilisai, Directors and Head of the various organizations, institutions in Telangana, my friends and all the invitees and media. I would like to convey my thanks to Madam for 3 reasons. Whenever I meet something or the other good happens, that I always have to thank Madam. So first is for inviting us and giving us opportunity on this very important discussion point of national importance, which is paying the path of taking us on the path of success and developed nation. Second, I want to thank ma'am for always helping us in encouraging and motivating in developing our new AIIMS, which is coming up about 30 kilometers from here for the people of Telangana. And the third is a very special thanks, ma'am, for coming to NIN recently on the Golden Jubilee Conference, which was organized by AIIMS Bibinagar. And Madam was chief guest. I want to give you the feedback, ma'am. There were 1,500 delegates coming from Srinagar to Kanyakumari, from north to east, west, everywhere. Big conference after COVID era. After the inauguration was over, at least 500, 700 people, they came to me and telling, we have never listened to such a speaker like Madam. Thank you, ma'am. Madam being a doctor, she connected with the doctor fraternity, that she knows what they want and what is to be done. And they really appreciate it, and Madam gave awards and fellowships to many doctors. Thank you, ma'am. On their behalf, it's a good opportunity I got to convey their feelings. For today's occasion, I have a small presentation, and Ma'am has already highlighted important features of the union budget of 23-24. Some of them I will be putting in the picture form, and so इसको थोड़ा सा एंगल इधर हो सकता है, so that I can, okay, okay, yeah.
You are unable to see that?
Slightly, yeah, slight angle. If you can keep it on this side.
Slightly towards you.
I am telling these last 2 years budget just for continuity, because when the budget is new initiatives are taken, many of the activities and the programs, they continue, and their budget is also earmarked in the next year's budget. So it's just to remind you that Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which is going on, 69,000 crore was there in the health sector. In 2022, if you remember, the target of 1,50,000 health and wellness centers was to be achieved. I will take up about the progress, where we stand today. And then was the generic medicines, very, very affordable medicines. That's called Jan Aushadhi everywhere in all institutions at every district. That was in 2021. And last year, the major focus was on the national digital health ecosystem, and you must be aware that a lot of activities are going on. I'll share briefly on that. And then for the first time, National Mental Health Program was introduced in the country with the help of NIMHANS. And then many programs, they were integrated, like Mission Shakti, Mission Vatshalya, and strengthening the Anganwadis, and nutrition, particularly nutrition program as portion 2. So these were the last 2 years. Now, as the Honorable Governor has mentioned, that there is a tremendous rise in the budget of this year. Now, if we see the last 2 years and this year which has been announced, we can see that there is increase of about 10,000 crore from the previous year. Now, the second part, we can see that is the health budget, third one. And there is increase if we compare over the years. But if we compare with the other sectors, we'll find that the proportion is relatively less. But the other sectors like rural development, agriculture, they are very big, and a lot of budget is required for them. Now, what we see that what has happened in last 22 years, you will be able to appreciate if you just see in the middle. It starts from 2000 and 2022. You can see the spending on the health has increased remarkably, and this graph is going up and up. If you see what was there in the first 10 years of the century, and if you see the last 10 to 12 years, we can appreciate there is a big difference. Now, as far as this year's budget is concerned, I'll say that 4 major important decisions which have been taken, where the budget has been given a lot of impetus, a lot of focus, as mentioned, Madam mentioned. One is the nursing college. And like we are in AIMS, and in AIMS it was decided that every AIMS will definitely have College of Nursing. We started in Bhubaneswar, all other new 6 AIMS were having. Now all the AIMS, which are 22 AIMS which are coming up, they all will have. It's a very wonderful, it's a beautiful decision, very path-breaking decision which has been taken by the Government of India. When we make a hospital like AIMS, we need at least 3 types of technical people. One is doctors, the second is nurses, and third is the paramedical technicians. So there is always a shortage of nurses and technicians. Doctors, we always know, we keep talking and we discussing. The second is the sickle cell anemia elimination. And third is the research, focus on the research, where for the first time, the public and the private sector, they have been brought together, and ICMR labs will be established more and more, and they will be able to do a lot of research in that. Fourth thing is regarding the PVTG development mission. This is called particularly vulnerable tribal group. Now these are the tribal communities who live in the most remote areas. I'm very happy to tell that 2-3 months back I was able to meet a very senior person, and I explained that PVTG, how I worked in state of Odisha with for these people, and I gave these modules, ma'am. I wanted to give it to you, that's why I bought it. So these were the modules which we will here. I'm very happy. Okay. This is for nearly 1 lakh people, which we work there and train to reach to these people. Otherwise, I cannot. Their language is different. They are living in the pre-agriculture stages. For now, the government of India has sanctioned 15,000 crore of money under the Pradhan Mantri PVTG development program over the 3 years. Now, as far as the nursing sector is concerned, there is a shortage. The current ratio is 1.96 nurses per thousand, and WHO norm is 3. With this decision of establishing 157 new nursing colleges in medical colleges which have come up after 2014, this is going to reduce this scarcity, and we will be able to reach these norms. The medical education, if we see, has been given a lot of importance because there is always a shortage of doctors and specialists in the country. But if we see in the last 8 or 10 years, we can see the number of MBBS seats have increased by 87%. PG medical seats have increased by 105%. Number of medical colleges have increased almost double from 387 to 664. Now, if we put the Ayush doctors along with the allopathic doctor, the ratio, the norm which is given as per the WHO, we comfortably meet that. The norm is one doctor for 1,000 population. With about 5.65 Ayush doctors, it comes down to 834. AIMS, which is the vision of our Honorable Prime Minister to have new AIMS in every state. You can see in this map that almost right at the bottom is the Madurai, Tamil Nadu, we can see, which is coming up, and then Mangalagiri, Bibinagar, and then in east, west, everywhere you can see, and now most of them are in working functional. 6 of them are fully functional, some more are in near fully functional, and some are in the early stages, and like we are one of them whose construction has just begun, but we are started providing the services to the people in the surrounding areas. Now this is regarding the Health and Wellness Center. I have never seen in last my 33 years such fast-paced execution of services. When it was announced in the budget, I mentioned 1,50,000 health and wellness centers. It already has crossed that target. 1,56,858 health and wellness centers are functional now at different levels, at PSC, urban, and Ayush. And this Ayushman Bharat, Prime Minister's journey, this program, PMJ, part of the Ayushman Bharat, a big budget has been earmarked for this, and this year further it has been increased by 12%. One important